most of the focus of the excitement has been around the exchanges and the requirements. As I'm going to show you and tell you, actually the other two pieces are far more important. There's $1.5 trillion of federal money going into subsidies for people under 400% of the federal poverty line to help them get health insurance. That's really what this is about. The other things are icing on the cake. But I learned something from this too, which is many things are not as easy as they look. And we all learned that because of the experience of rolling out the health insurance exchanges. So that was a pretty dismal moment. Isn't that sad? Yeah. And if you remember the reporting on it, the way the story got told was really this. The picture, the area in NYU purple are the states that decided to do their own health insurance exchanges. And this is what enrollment looked like in the first month after the exchanges opened. So these are the federal exchanges and those are the state exchanges. And so you got the media saying the feds are incompetent, the states are able to do this is a disaster, yada, yada, yada. Now one thing you can see if you look really closely at this picture is if you look at the state exchanges, some of them look really good, but there are a bunch of blank spaces in that chart, right? Which actually nobody really seemed to notice until months into this. But it actually turned out that the federal exchange was kind of moribund, and some of the state exchanges were dead. They were not just not working very well, they were not working at all. So there was a real diversity in terms of what was going on. And actually, the story in the beginning was, Oregon doesn't work, and Hawaii doesn't work, and Massachusetts, they had done it before, it didn't work, and Maryland doesn't work. And Minnesota doesn't work. So all these states with good governments and good governors and their exchanges are not working either. This turned out to be actually a much more tricky problem than people had kind of given it credit for. The next thing that happened is that time passed. And everybody had been really excited about the opening of the exchanges, and that was going to be the transformative moment. But that's not how it happened. What happened is, so the first green lines are the first month of the exchanges. The red lines are everything up to the beginning of March. And then that's after the beginning of March. Okay, so a couple of things to note here. One, there's hardly any difference between the federal exchanges and the state exchanges by the end of the day. The mess up with the rollout of Healthcaregov was a political disaster, but it made very little difference in the end to the number of people who enrolled. Indeed, what is actually quite astonishing here is that the Congressional Budget Office actually got the number right. They did a pretty good job of predicting how many people would enroll, and they were not counting on whether Healthcare.gov worked or didn't work. That's not how their numbers were working, because they had no idea what a Healthcare.gov was. We'd never seen one before. The reason it worked is that it wasn't about a website, and if we had really thought about it, we would have realized that the website was going to be a pretty trivial part. So this is new data from the California Exchange, which has been so good that they actually have all their spun out data up already. And what's really amazing about these numbers is that in California, where the exchange worked from day one, only about 40% of people who enrolled did it by themselves on the website as if they were doing Travelocity. 60% of the people who enrolled used someone else to help them do it. So everybody had thought this is going to be about building a clean and careful website where you can do all the work yourself. It turns out that buying health insurance is a very complicated thing. People are not really comfortable doing it just clicking on a website. They need someone to walk them through it. And so in fact, 60% of people got enrolled by having somebody walk them through the process. Second thing that we didn't think about is why don't people have health insurance? And if we thought about that for 1 second, we would have realized the answer is not because there is no website. If you actually looked at why people don't have health insurance, the number one reason was it's too expensive, and most of the other reasons come down to it's too expensive if you actually work them out. And indeed, the key thing here is the exchanges have $800 billion in subsidies going into them. And that, much more than their web design and all of those lovely features, is really why people are getting health insurance. Again, from the California Exchange, 88% of the people who buy health insurance on the exchange are getting subsidies. They're buying health insurance on the exchange because it's cheap for a change and they can actually come close to affording it. And I haven't even added in here the Medicaid people who are getting coverage without paying premiums at all. So this was always about the money, and somehow in the run-up to this we forgot that it was about the money. Last piece of this, also about the money, is the Medicaid expansions. We will see how that changes over time. So health reform is a very big deal. This is my new slide also about the newly insured as of April 2014. So here are the newly insured. There are 10 million, roughly, newly insured people under the ACA. How many people is 10 million people? It's more people than there are in Switzerland. It's about 2/3 as many people as there are in the Netherlands. It's about 1/3 as many people as there are in Canada. This is a very big country, so 10 million people doesn't seem like a lot, but this would be like Switzerland reforming its entire healthcare system from a human being point of view.
Just a little small compared to China.
Very small compared to China, very small. But they haven't reformed their healthcare system yet. So it's also a really big deal compared to Medicare and Medicaid, which we think of as these huge transformative programs. So these are data for what's expected by 2016. You can see that more people will be enrolled in the ACA in 2016 than were enrolled under Medicare and Medicaid in the expansions. And the green dots are the percentage of the population, roughly the same percentage of the population as was enrolled through Medicare and Medicaid. But it's a much more targeted program. So the number of newly insured people through the ACA is actually much higher, and much higher as a percentage of the population than was true with Medicare and Medicaid. The effect on the uninsurance rate will be much bigger than was true with Medicare and Medicaid. So a very, very big deal.